Now to the COVID-19 disaster in India. More than a year into the pandemic, the caseloads and deaths in this South Asian nation are skyrocketing. As Amna Nawaz reports, while vaccines are being rolled out, stopping the spread is proving a monumental task.
A grim reminder in India that the global pandemic is far from over, as the second most populous country in the world recorded the most new COVID cases in a single day, nearly 315,000, more than any other country at any point in the pandemic. India's infection total of 15.9 million is now second only to the United States.
People are really scared. They are terrified. Most people have isolated themselves in a self-imposed lockdown. They are not stepping out unnecessarily, and the roads are all empty.
Early in the pandemic, in March of 2020, Prime Minister Narendra Modi swiftly imposed a nationwide 21-day lockdown, the largest in the world. But in recent months, even as cases rose, Modi hosted huge political rallies, flouted social distancing, and allowed mass gatherings, including thousands of Hindu pilgrims at a time along the Ganges River for the Kumbh Mela festival. On Tuesday, Modi addressed the virus surge.
Till a few weeks ago, the situation was in control, and then this second wave of coronavirus has come like a storm. Friends, in the current situation, we have to save the country from another lockdown. I would also like to request states to only use lockdown as a last resort.
Meanwhile, India's hospitals are overrun, oxygen supplies are depleted, and crematoriums are overwhelmed, leaving some, like Vinay Srivastava, begging for help online. The 65-year-old journalist tweeted as his oxygen levels plummeted, quote, "My oxygen is 31. When some will help me," he wrote April 17th. No hospital could take him, and he died soon after. On Wednesday, an oxygen leak in western India led to 24 deaths, including this woman's mother.
My mother died. She could not get oxygen, and she died in agony. She has been here since the past 5 days. She had recovered. There was no oxygen. She died in agony. She had trouble breathing. She died. Everyone there died.
The New Delhi High Court has ordered the government to divert oxygen from industrial use to hospitals to try and save lives, as the number of coronavirus cases continues to grow.
Dr. Ramanan Lakshmi Narayan is an economist, epidemiologist, and senior research scholar with Princeton University. He joins me now from New Delhi, India. Doctor, welcome to the NewsHour, and thanks for joining us. You are in New Delhi. Can you just describe what it is you're seeing there?
It's probably the worst humanitarian crisis that I've ever witnessed. There are people without hospital beds. There's no oxygen. I'm hearing of people who are dying because the oxygen ran out in their hospitals. It's undescribable, and I hope to never witness anything like what we're going through right now in Delhi.
As an epidemiologist, when you see that spike, you see that curve going like this, do you worry what happens if that goes unchecked?
Well, as an epidemiologist, I know that the place that curve goes is basically determined entirely by human behavior and people's attitudes. So it's there because mass gatherings were allowed, because the messaging was poor in terms of how serious the virus was and is, and the system is already overrun right now, and it's hard to imagine what it's going to look like when we have another million cases over the next 3 or 4 days and another million after the next 3 or 4 days after that.
You mentioned the mass gatherings, the reopenings. We all remember when Prime Minister Modi locked down the entire country. What led to the decision to reopen to this degree?
The country was locked down when the cases were only 500, simply because there was an understanding that it could simply not deal with the kind of upswing we're seeing right now a year ago when the system was unprepared. After September, the cases started coming down, and like with many other countries, people both in government and outside assumed that the worst was over and that India had, crossed into some sense of herd immunity and the cases were not going to come back. Now, that was obviously not true. In a country the size of India, even if you have 300 million infections in the first round, that still leaves over 1 billion people who've not yet been infected. And that's sufficient to have a second, maybe even a third and a fourth wave. And that's what we're seeing now.
Many of the reports we're seeing are coming from urban centers and from city locations. What about the non-urban areas? What about rural areas where we know the majority of India's population lives?
70% of India lives in rural areas, and the virus is definitely spread there. In fact, even on this round, the predominantly affected populations are the urban well-off who escaped the virus in the first round. The lockdown protected the well-off even as it ravaged the poor in urban areas. This time around, it's definitely in rural India as well, where the infrastructure is much weaker.
What about vaccines, Doctor? We know India is a vaccine producer. Where is India in its vaccination process?
India got off to a great start with two vaccines, one developed by Oxford and licensed to India by AstraZeneca. The other one was a truly indigenous Indian vaccine. India was exporting a lot of vaccines, but the production was not accounted for properly in the sense that there's a shortage of vaccines now. There's hardly enough even to meet the domestic demand, let alone export vaccine to other countries.
We know some states have implemented lockdowns. Do you expect there to be more leaders taking that step? Do you think another national lockdown is necessary to slow the spread now?
I think a national lockdown is unlikely, both because it's probably not necessary. The virus is not bad everywhere. It's probably not sustainable given the condition of India's economy. But state-level lockdowns, like in New Delhi, Maharashtra, these will likely continue. And in some sense, that's the only tool that is left to governments to be able to signal the seriousness of the virus.
If that messaging is not made clear, what do you worry will happen?
If that messaging is not made clear even now, after all the scenes that we all hear, every family has been affected by COVID at this point in time that I'm aware of. But if people don't take that seriously, both policymakers and ordinary folks, we could see this being a lot more painful over the next few weeks than it already is.
That is Dr. Ramanan Lakshminarayan joining us from New Delhi, India tonight. Thank you so much for your time, Doctor. We wish you well.
Thanks for having me.